Hello, parents and caregivers. Today, we're addressing a situation that can be quite alarming when a baby falls off the bed. Despite our best efforts to keep our little ones safe, accidents can happen in an instant. It's natural to feel panicked or guilty, but it's crucial to know how to respond effectively and when to seek medical attention. Let's explore the steps to take immediately after a fall, signs to watch for, and when it's time to worry and consult a healthcare professional. Number 1. Immediate response after the fall. If your baby falls off the bed, it's essential to stay calm. A calm response helps you assess the situation more accurately and respond appropriately. Check for immediate danger. First, check if your baby is breathing normally and is conscious. If your baby is unresponsive or not breathing, call emergency services immediately. Do not move the baby. Unless your baby is in immediate danger, such as near water or a hot surface, avoid moving them right away. Moving them can potentially cause further injury, especially if there might be a neck or spine injury. Assess for obvious injuries. Look for any visible signs of injury, such as bleeding, swelling, or bruising. Check your baby's head, limbs, and body for any cuts, bumps, or deformities. Number 2. Comfort and observe. If your baby seems alert and responsive after the fall, gently pick them up, comfort them, and closely observe for any unusual behavior or signs of distress. Watch for signs of pain or discomfort. Your baby may cry immediately after the fall due to fright or minor pain. However, if they continue to cry inconsolably, it might indicate pain from an injury. Check for changes in behavior. Monitor your baby's behavior for the next 24 hours. Look for changes in their usual behavior, such as increased irritability, excessive sleepiness, or refusal to eat. Number 3. Signs to watch for. Some symptoms may indicate a more serious injury that requires immediate medical attention. These include vomiting. Vomiting more than once after a fall could be a sign of a concussion or other head injury. Seizures. Any shaking or convulsions are a cause for immediate concern. Loss of consciousness. If your baby loses consciousness, even briefly, seek medical help right away. Bleeding or fluid from nose or ears. This could indicate a skull fracture or other serious injury. Pupils of unequal size. Unequal pupil size can be a sign of a head injury. Changes in eating or sleeping patterns. Difficulty feeding, refusal to eat, or changes in sleeping patterns, such as sleeping more or less than usual, can indicate discomfort or injury. Difficulty breathing. Labored or irregular breathing requires urgent medical attention. Number 4. When to seek medical attention. If any of the concerning signs are present, or if you're unsure about the severity of the fall, it's always best to consult with a healthcare professional. Call your pediatrician or go to the nearest emergency room. It's better to be cautious, even if it turns out to be a false alarm. Number 5. Preventing future falls. While it's impossible to prevent all accidents, there are steps you can take to minimize the risk of falls. Never leave babies unattended on elevated surfaces. Always stay with your baby when they're on a bed, changing table, or any elevated surface. Use safety equipment. Use bed rails, safety gates, and other safety equipment to prevent falls. Supervise playtime. Ensure that play areas are safe and free from potential hazards. Educate older siblings and caregivers. Ensure that anyone caring for your baby is aware of safety precautions and knows not to leave them unattended on elevated surfaces. Number 6. Post-fall care and follow-up. Even if your baby seems fine after a fall, it's a good idea to monitor them closely for the next 24 to 48 hours. Keep an eye on their behavior, feeding, and sleeping patterns. If you notice any changes or have concerns, don't hesitate to contact your healthcare provider. Follow-up appointments. If your baby was evaluated by a healthcare provider, follow any recommended follow-up appointments to ensure there are no delayed symptoms or complications. Number 7. Dealing with emotional aftermath. It's normal for parents to feel guilty or anxious after such an incident. Remember that accidents happen, and the most important thing is to respond appropriately and ensure your baby's safety. Take time to process your feelings and seek support from family, friends, or parenting groups if needed. In conclusion, while a baby falling off the bed can be a frightening experience, knowing how to respond and what signs to look for can help ensure your baby's safety. Always prioritize your baby's well-being by seeking medical attention if needed and taking preventive measures to avoid future falls. Remember, you're doing your best, and being prepared can make all the difference. Thank you for joining me in discussing this important topic. Stay informed, stay calm, and continue to provide a safe and loving environment for your little one. See you next time.